Hi, my name is Mr Nakhla. I'm an orthopedic consultant, and I'm going to tell you about the risks and benefits of having your partial knee replacement. The reason we're doing a partial knee replacement for you is that it's only one of the three compartments in your knee which is badly affected down to bone and needs replacing. The advantage of a partial is that it's a smaller operation and recovery is quicker, and you have more natural sensation of the knee because of the ligaments being preserved. The disadvantage of a partial is that because we're preserving the other compartments of the knee, arthritis in those compartments can progress. So progression of osteoarthritis, and there is a slightly higher revision rate over 10 years of about 3%. Following surgery, pain might persist and knee replacements can become stiff, whatever we do. There is a risk of infection, which is very unlikely, and the risk of infection is lower following a partial knee replacement compared to a total knee replacement. There's risk of bleeding. It's very unlikely to need a blood transfusion, and I don't recall a patient with a partial knee replacement needing a blood transfusion. Blood clots in the leg, not a big problem in the leg. Problem if they go to the lung, which can even be fatal, but we'll give you stockings, tablets, and get you up and running as soon as possible to avoid them. The main thing is to get you up and running, and I do many of my cases as day cases, and you go home same day of the surgery. There are risks to nerves and vessels around the joint. I'll be very careful with the big ones, but the common thing everyone gets is an area of numbness around the scar because small nerve endings cross from the inner aspect to the outer aspect, and I have to cut through them. This usually recovers within 12 to 18 months, but even when it does not recover, people prefer it being numb rather than painful. The bone can break around any joint replacement. If this happens, I'll fix it for you. It can end up being stiff or unstable, but hopefully not. I look forward to doing your partial knee replacements and getting you back to your full activity and full mobility and to enjoy life to its fullest.